16 of the 21-day lockdown, and India has seen a rise of deaths in the last 24 hours. That is 17 in number, and the total death toll has risen to 166. The total number of positive cases in India is 5,734, and we are inching closer to the figure of 6,000. Meanwhile, rapid measures are being undertaken to plan out an exit strategy for many places in India where economic activity can once again resume. So this is being discussed between centre and states, but meanwhile some places have also been identified as hotspots and the lockdown has been extended there, and the restrictions have been made more severe. For instance, two places, Delhi, the national capital, and Noida, have been sealed. Several hotspots of the COVID-19 have been sealed in these areas, and the governments have assured that essential supplies will be delivered, so that's not a cause of worry. In Delhi, 20 hotspots have been identified and sealed. In Noida and Greater Noida, 22 hotspots have been identified and sealed. This means that people cannot leave their homes, they cannot gather anywhere in their neighborhood, they cannot be on their lanes outside their houses. Extremely severe restrictions have been imposed in these places. Another development coming in from the Oneindia Institute of Medical Sciences, 30 healthcare workers over there have been advised quarantine. Now, this is an issue cropping up in many healthcare institutions across the country. In this case in AIIMS, what happened was that a 70-year-old patient who had reported some other problems, neurological symptoms, was admitted in the cardio-neuro ward, and later he developed symptoms of the COVID-19, which was when he was tested and he turned out positive. So anyone who came in contact with him among the healthcare staff have been advised to be under quarantine. This problem is surfacing in many places. Patients come in with different problems and then they're admitted in other wards, and only when they develop symptoms are they tested and then they're taken into COVID-19 isolation wards. So any healthcare staff who's come in contact with these people while they have been admitted in other wards are not taking the kind of precautions COVID-19 wards are taking, so then these people are more susceptible, the healthcare workers become susceptible to the disease. This is a concern, of course, and governments now have to think about whether the PPEs, the personal protective equipment, should be made compulsory throughout hospitals for every kind of healthcare worker. If we have the resources to do that, and if we don't have the resources, then could we ramp up and the production of PPEs to such an extent that not a single healthcare worker, whichever department he or she is working in, all of them should have this necessary protective gear. Also, a lot of onus lies on the public themselves to be transparent about their travel history, to be transparent about every kind of symptom they're experiencing when they get themselves admitted to hospitals. This will be a huge help to our medical staff, and they are our frontline workers at this point. We cannot afford to lose, or we cannot afford to have a shortage of healthcare workers. We cannot afford to have them under quarantine at a period of time when it is essential for them to be on duty. Now, the government is now pushing for testing. It's the third week. The last week, it was supposed to be the last week of the lockdown exercise, and now the government has realized that if the disease were to resurge, then that would be a second wave of the disease. It would be a bigger problem. So now the government's strategy of testing has changed. It's also testing people in those districts. There are about over 400 of these districts in which no coronavirus cases have been reported so far, but these districts will also be undergoing random tests in order to verify that the disease has not broken out in other places, that this lockdown exercise has worked, that the disease has been contained to those hotspots that have so far been identified. In order to ascertain the extent, the success of this lockdown and the success of containment by our healthcare providers, these random tests in COVID-19 free districts are also going to be undertaken for a realistic estimation of what kind of trajectory this outbreak is taking. And now the governments, after finding the results in these districts, can now further plan out a roadmap of how to control and how to monitor this disease. And in the last news that we have today is of it's a positive news. Now the Supreme Court has said, has ordered in fact, that all testing for COVID-19 be made free, even at private diagnostic labs. So the government hospitals were already giving free of cost testing for anyone who wanted to avail of the same. And now even private diagnostic labs that have been roped in for COVID-19 testing have been ordered by the Supreme Court to give this service for free, because at this time when we are battling a pandemic, that there should be no one who gets turned away from any testing center for the lack of money. That's what the Supreme Court has said. These were the big developments so far. Let us know if you have any questions. Let us know if you have any suggestions in the comments below.